Hello, thanks for joining me. I'm going to talk to you about health. You see, I just discovered after having gone through cancer treatment 2 years ago, the whole 9 yards, that I have breast cancer again. So the whole thought of going through getting a port put in, getting chemotherapy, getting surgery, and then going through radiation and basically occupying a whole year of my life, losing my hair, of course, which I've finally just grown back, eyelashes, eyebrows, the whole 9 yards. Um, that whole thought just overwhelms me to pieces. I'm not the youngest anymore. I'm 62, but I do have children. One who just turned 17 and one who is going to be turning 24. So there's that consideration. It's been a rough couple years. Shortly before I got my diagnosis, my marriage collapsed. So I was just out of that for, well, not fully out, but we were separated just for a couple months. I turned 60, got the cancer diagnosis, and bing, that took up the next year and a half of my life, pretty much. So, trying to get back on my feet. Now I'm faced with this again. And so I'm honestly just trying to figure out what I'm going to do because part of me says, oh, well, I had a good run, time to throw in the towel. And part of me says, well, let's see what they have to say. But I don't want to be rushed into making any decisions about my health or just do what everybody tells me to do like I normally do because I'm a good girl. So this is my journey and I'm going to document it. I haven't decided what I'm going to do. I'm rather thinking about just going through the staging tests, which are coming up next week, seeing what they say. But in the meantime, trying to manage my inflammation levels through diet. So I'm watching lots and lots of videos, reading books, posts, whatever, just trying to see what the most recent research says and what to eat, what not to eat, what to do, what not to do. Just taking the pieces I can use and trying to build my own story out of it. So I'll just keep going with this, and either I'll be healthy again or I'll be dead. But you won't get to find out unless you keep watching my videos. So if you want to join me on this journey, I invite you to join me. And if you have questions about anything, maybe you're going through a similar journey, maybe we can talk about it. So that is what I'm planning to do. And right now, honestly, I'm rather inclined to say, let me work on the inflammation myself without a big intervention from the pharmaceutical companies, and try a cheaper approach. Walnuts, berries, if you look out there, there's lots of research that's already occurred for what to do and what not to do. And that's not to say that chemo and the whole medical field is wrong. It's just maybe not the choice I want to make this time around, because I want to enjoy life as best I can. And I don't think that that's part of my journey this time. Who knows? Maybe I'll change my mind and I'll keep you updated on that. But my inclination as of now is to say, take it out, take out the bad spot, and then let's just deal with it that way and see if we keep an eye on the inflammation and see if we can conquer it with a little less aggression. So I look like I'm fairly level-headed at this moment. I haven't been. It's been a rough 2 weeks because I am finding this all out and thinking, oh, I've been through the whole gamut of why me? And oh, whatever. I don't want to do this anymore. Let's just be done with it, and everything between. And so, like I said, I'm I'm the sort of person who likes to look for the silver lining in everything and see what lessons are to be learned. And I'm kind of thinking that my lesson to be learned is I've had this body that's been taking care of me all this time, and I have not treated it very well in many occasions throughout the years. In some occasions I have, some not, but with the stress of the last, I say 7, 10 years, it's not been my strong point. So I'm going to start taking better care of myself. And actually, I had started doing the anti-inflammation type of eating, about a week before I had a regular checkup. And then they said, we got to biopsy you again. Ouch, ouch, ouch. So once they did the biopsy, I thought, okay, this is it. I don't need the results. I know it's coming. And sure enough, a few days later, cancer's there. So I've been through the gamut of emotions about that. And I'm just trying to sort through it. What is my lesson? What is my mission? Maybe my lesson, my mission is helping other people with what I figure out or don't figure out. And please, I'm in no way saying that you should shun the medical profession when you have cancer and you shouldn't do treatment. This is just a decision I'm trying to make on my own for my own personal situation. And so it's an up and down ride. Today I was at the doctor to get my thyroid checked they told me to, for before the staging or something, and get my thyroid levels checked. And it seems that I have a big, which was a small knot, and now it's a big knot. And so I have to get that examined with a PET scan and whatnot as well, apparently, all on Monday. So what is it today? It's Thursday. Monday, big day. I've got 3 big exams. I'll probably be doing nothing but sitting in doctor's offices and getting injected with things and getting shoved in machines. And boy, isn't that fun. We're going to have a good time. But this is my journey. So if you'd like to join me, welcome, subscribe, or whatever. And join me. Let's go through this together. And I will keep you posted. Okay, bye.